Great. Again, welcome to our next session in our Parent Empowerment Conference. We are excited tonight to welcome Dr. Melissa Dvorsky. She is a clinical psychologist and director of the ADHD and Learning Differences program at Children's National Hospital. She's also an assistant professor of pediatric psychiatry and behavioral sciences at the George Washington University School of Medicine. She is the developer and director of advanced tools for organization management, which is a school program for teens who struggle with organization, time management, and planning skills. Dr. Dvorsky's work is focused on partnering with schools and communities in advancing school mental health care, improving access to, and the effectiveness and sustainability of school interventions. So Dr. Dvorsky, I'm going to go ahead and stop sharing my screen and turn it over to you.
Welcome, everyone. Start sharing. Okay. Can you see the screen okay? Awesome. All right, great. Oh, and it says on my screen, Jennifer Jones is in the waiting room. I don't know if I need to click anything else. All right, well, welcome everyone. Thank you for having me. It's my pleasure to be here this evening and talk with you all. I'm here tonight to talk about ADHD, some different ways of understanding and demystifying different things about ADHD, as well as our what we know about how we effectively manage ADHD in children and adolescents. I know this is a topic that, because of how common ADHD is, it's one of those things that can be really overdiagnosed or misdiagnosed, but it can also be underdiagnosed in kids and adults too. So this is something that folks have a lot of questions about, and I'm happy to answer anything that you are wondering about, even if it's not something that I'm going to talk about tonight or that's in the slides, but if it's related to ADHD and you have a question about it, please feel free to put that in the chat, and happy to engage in those questions. Okay, so my disclosures: I have funding through the NIMH for my school-based project called ADAM, or Advanced Tools for Organization Management, and I'm also employed by George Washington University and Children's National, but I have no conflicts of interest to disclose. Okay. So what is ADHD? ADHD is a persistent pattern of developmentally inappropriate levels of either inattention, hyperactivity, or impulsivity. And so symptoms are generally kind of clustered into these three different groups: inattention, which can look like having trouble paying attention, or making careless mistakes in schoolwork, rushing through things, or being distracted. It could be impulsivity, which can look like interrupting someone. Impulsivity can also be, reacting on frustration really quickly, or getting upset quickly. And so sometimes that could be breaking rules in class or at home too. And then, of course, what a lot of people think of when they think of ADHD is there's the third cluster, which is the hyperactivity. So fidgeting could be difficulty kind of staying in your seat when expected, like if you have to sit in your seat for church or at dinner, and having just a really hard time, sitting even outside of the classroom. And so when we say developmentally inappropriate levels, this means that it's more than what is typical for that age, because let's face it, we all have times where we felt kind of distracted or maybe even fidgety, like we needed to get up and move around, or maybe you said something and impulsively, or did something impulsively that you regretted afterwards. We've all experienced those things. And so this is very much something that happens sort of on a continuum or a spectrum. And so when it meets criteria for ADHD, it means that it has to be happening quite a lot and more than what's expected for that child's age. And so that means 6 or more symptoms in either two areas, either inattention or hyperactivity, impulsivity, or both. It has to also persist for longer than 6 months. And these symptoms have to be present before age 12. So I think about usually, that they're present before the end of or around the middle of middle school grades. Not only do the symptoms have to be present, but we also look for how they're impacting a child or an adult's life. So for it truly to be ADHD, it can't really only happen in one setting. It needs to be causing difficulties at home and at school, or at home and with peers, or in social relationships or family relationships. So we look at kind of multiple domains or settings where one lives. When we diagnose ADHD, it is based on talking with parents and teachers and getting information from multiple reporters. So whenever a diagnosis of ADHD is made, it should always involve with children, it should involve at least collecting rating scales or talking with a teacher, or perhaps doing classroom observations of behavior at school, as well as talking to parents about what they see at home. So we do clinical interviews to understand those, and we collect standard rating scales, which is forms that have kind of questions that describe certain behaviors that are typical or not typical, and you rate kind of how often you may see those things. And then of course I mentioned observations too. Those are great when we can do those in the school. We can also do observations in a clinic setting too. Okay, so some key facts about ADHD. How common is it? ADHD is actually one of the most common childhood mental health diagnoses. It's present in nearly every classroom across the country, because it ranges from anywhere from 5% to 15%, or 10%, sorry. So you can think about it as about 1 in 15 kids usually meets criteria for ADHD. Another question we get asked a lot is, how long does it last? For most children that are diagnosed with ADHD, the symptoms of it actually do persist into adulthood. There's been studies that have shown that it is roughly 80%. And sometimes really how ADHD looks in a child versus an adult is quite different. And that is why we actually call those different sort of presentations of ADHD, we call them presentations now instead of subtypes, because that really recognizes that it's more this fluid nature, that some symptoms go away or kind of decrease a little bit. You don't see very many, 14 to 18-year-olds with ADHD that are running all over, climbing on furniture that they shouldn't be on, or having difficulty, sitting maybe at the dinner table. So as kids get older, developmentally, some of those symptoms kind of decrease. It doesn't mean they go away entirely. Usually people still feel this internal feeling of restlessness, but maybe kind of how they present those symptoms to the world kind of change or evolve. And people also learn how to kind of compensate for the symptoms, and they might do things to sort of self-manage or self-control them to make those symptoms less obvious to others too. So why should we care about ADHD? It can lead to untreated ADHD or unmanaged ADHD can lead to difficulties with school, with friends, with family. And ultimately, all of these challenges that one might experience with ADHD can really impact self-esteem too. And that's a big sort of under-focused or emphasized area, but is sort of how kids with ADHD feel about themselves, and how that evolves over development too. So I mentioned this earlier, most children don't outgrow the disorder. However, the nature of how it presents in every individual might change. And so let's shift to talking about what causes ADHD. So it's very important to note that although the environment is important, and it does not actually cause ADHD, or ADHD is not caused by environmental factors alone. It really is this combination of both neurobiological and environmental factors, similar to high blood pressure or diabetes. So it can be managed through behavioral strategies in a big way. But there's also this neurobiological component that even with behavior strategies, it can make it difficult, depending on sort of the severity or the presentation of someone to, they can still experience difficulties. And then the last bullet point here, I'll just say, it says delay in development. And what that's referring to, I'll show you in a couple of slides what we see, but primarily what that looks like is delay in the development of executive functions, which are sort of the conductor of your orchestra, the conductor of your brain. They're the person they're the thing in your brain that is responsible for kind of everything else that needs to happen for attention regulation, for emotion regulation, for controlling your behavior. And I'm going to talk about executive functions a lot tonight. It's not specific to ADHD. Executive functions are something that we see that impact a lot of different populations and a lot of people, and they grow and develop in everybody. And what we really see in ADHD is that executive functions, kind of the development of them, and that they get developed in the prefrontal cortex, which is in the front of your brain, that happens a little bit slower, a little more delayed in children with ADHD. They often eventually kind of catch up and do have similar maturity, but we really see it a lot in young kids that it can be anywhere from about a third to a fourth of their age at time when you expect them to have management of their behaviors. So executive functions really are at this cornerstone. They're responsible for your emotion regulation, your ability to kind of stop doing something that you shouldn't be doing, to start doing something. They're responsible for being able to manage distractions that come your way, to think before you act. And they're really important for controlling your behavior and your attention. So let's dive into this a little bit more and talk about why people with ADHD experience these difficulties with attention, impulsivity, and hyperactivity. I mentioned before, it's a neurodevelopmental disorder. And this neurodevelopmental condition means that it causes developmental sort of deficiencies in how one regulates their attention or controls their impulses. And these delays in that maturation of your executive functions is largely caused by, is largely neurobiological and caused by genetics. And we know that because we've done a lot of family studies and twin studies that have looked at how ADHD is a highly heritable disorder. And so if a parent has ADHD, their child is 6 to 8 times more likely to have it too than a child of a parent without ADHD. And similarly, if a sibling has ADHD, then that child's sibling is anywhere from 3 to 5 times more likely to have ADHD too. Okay, so let's dive in for a little bit about executive functions. What are they and why are they important? How are they relevant to ADHD? And I like to think about executive functions as really this sort of broad framework. This slide with all these words on here is just to kind of emphasize that it's this big umbrella term that really refers to these cognitive processes that are important for kind of doing what one wants to do, or doing kind of what they intended to do, or what aligns with their goals. So sometimes we hear things like self-control, self-monitoring, working memory, organization, planning, cognitive control, time management. These are all executive functions, just as emotion regulation and task initiation. These are also executive functions. And so this slide here just shows how executive functions develop over the course of a lifetime. So these are pictures of different MRI scans from healthy children and teens over time. And the like yellow and green and red parts of the brain are the less developed, and the purple and blue parts of the brain are the more developed. And you can see the 5-year-old brain versus sort of a preteen brain, like an 8 to 11-year-old, a teenage brain, and a 20-year-old's brain. And you can see the part that's really darkening is this prefrontal cortex, which is the front part of your brain, and it actually keeps developing into your mid-20s. And so we also want to think about what is developmentally appropriate when it comes to executive functions, because a 5-year-old really doesn't have strong executive functions. They're getting stronger as a preteen and a teenager, but they're still it still explains why we see a lot of impulsivity or risk-taking, behaviors in teenagers relative to when we get older and older. So to demonstrate kind of the delay in development that we see with ADHD, this is a study of a little over 400 youth that ranged from preschoolers to young adults, where they had their brain scanned at least twice at 3-year intervals. And I'll just push play so you can see. On the left is the children with ADHD, and on the right is the typically developing children without ADHD. And on average, compared to those typically developing youth without ADHD, they had their brains, developed a little bit slower, anywhere from a couple of years behind. So when a child was around 10 and a half with ADHD, the brain scan showed that the frontal lobe was the development of what the other children's at around 7 and a half were. And so truly it's this ability to control their behavior and attention that is developing just a little bit slower in individuals. And we've now seen that from this neuroscience research that's been coming out too. So big part of what executive functions are is inhibition, and behavioral inhibition is just a fancy term, which means kind of being able to control your behavior. Inhibit means sort of to stop. And so you can see it's sort of this ability to like put on the brakes, to stop and think or do. It allows you to kind of pause in the moment and think, oh, I'm feeling this way, I should do this, or this is the 3rd time Netflix has circled through, maybe I should get up and do the laundry or make dinner. Or it's the ability to kind of stop and think in the moment and not let the kind of moment get carried away. And when children can't inhibit themselves, they're going to react to the most stimulating thing that's happening in their environment. And so their environment is kind of controlling what behaviors they choose or what they do based on what is most exciting, engaging, or stimulating to them. And for children with ADHD, a lot of times this is screens or video games, because it's both kind of visually stimulating and it has auditory. And sometimes if you're holding the controller, like that's even shaking. So there are many different pieces of the senses that are stimulated that make that way more interesting than mom saying, hey, it's time for you to get up and empty the dishwasher. And so this is what makes it so difficult to kind of stop and do the right thing, even if you know a consequence might be tied to that. Okay. All right, so let's give an example here. If a child has age-appropriate inhibition, they want ice cream, they're thinking, wait, if I eat ice cream now, then mom's gonna yell at me and I'll get in trouble. So if I wait, I can have ice cream later. That's with good inhibition. So they can do this without getting in trouble. If inhibition is weak, they're going to be more likely than not to just go into the freezer and get the ice cream, despite knowing they're going to get in trouble. And this little cutie pie here is sort of, you see it, you want it, and you get it, and you don't stop and think, even if this has happened 10 times before and the same consequence is happening. So oftentimes families or parents of children with ADHD will get really frustrated by the fact that their child is sort of repeatedly making the same mistakes. And this is really because they're not doing the stopping and thinking, and because their brain that's responsible, the part of their brain that's responsible for that is not as well developed or as strong yet. And so this makes this more challenging for them. Okay. It also allows the child to stop doing a behavior that's not working and try something else, which is really important for problem solving, or when you're kind of stuck on a homework problem that you don't know how to do and kind of moving on to the next one in order to circle back. Oftentimes kids can get really stuck and have a hard time moving on or trying something else different. Inhibition also allows a child to make use of other kind of executive functions that I'm going to go into that are really important for self-management and self-control. So what are some of those other executive functions? I'm going to talk about working memory, internalized speech, which is basically self-talk, emotion regulation, problem solving, and ultimately how this all relates to self-control. And this is according to Russell Barkley's model of ADHD, or executive functions, that really this theory is that everything kind of is responsible, or the inhibition is responsible for these next kind of level executive functions, which then drive really someone's ability to control their behavior or their attention in the moment. So what is working memory? It refers to this system that actively holds information in mind so that it can be manipulated or used later or in the moment when you need it. So working memory is there whenever we have to do math calculations, when we have to hold instructions long enough in mind, long enough to execute them, or hold information in long enough to write it down. It's our ability to kind of read an instruction at the top of a worksheet and hold it in mind long enough to understand what it's telling you to do by the time you get to the end of the 3 sentences, and hold it in your mind as you're going through and solving that problem. It's also working memory, sort of the gateway through which we get information into our long-term memory. So it's sort of functions in the working memory, and then that's how we kind of use this when learning new information too. So this is really important in school, when taking a test, when having conversations with your parents about what you're going to do later in the evening, your responsibilities, tasks that you that require you to think about the past experience in order to kind of guide your behavior in the moment. It's responsible for a lot of different things in life. And when we have difficulties with working memory, that can lead to challenges with recalling what was previously learned, like forgetting spelling words, even though you knew them when you practiced them at home, or forgetting how to solve math problems when you're at home doing homework, when you just learned it at school earlier that day. It can also look like having problems with multi-step directions, like when mom says, go upstairs, wash your face, brush your teeth, put on your PJs, and then come back down and we'll do your story before you go to bed. And holding in your mind all of those steps that were just told, and not getting up the stairs and then forgetting 1 or 2 or all of those things. It's also your perspective memory, or your ability to kind of remember to remember. So when someone tells you something that you need to remember at a specific point in time in order to do that thing. This happens a lot, when you're prompting your child before going into the grocery store about the rules of keeping your hand on the cart, and can they remember that rule as you're moving through the grocery store and they're getting distracted by everything that's happening. So it's the ability to kind of hold information in mind long enough to use it. Working memory can also lead to an impaired sense of time. And so for children with ADHD, this means that they can perceive boring or difficult tasks to take forever, and interesting tasks to take no time at all. It's sort of this time blindness, or having little awareness of the passage of time, which is why oftentimes kids will say, 5 more minutes, or I'm just about done, and it can easily be 30 minutes or an hour. This sort of impaired sense of time is really commonly seen in kids with ADHD. Having difficulties or delays in the development of sense of time can also result in kind of the moment, having much more control than prior experience or future sort of consequences. So that ice cream example, I just really want the ice cream. It looks so good. The ice cream truck is outside and it's making that sound, and I know I'm going to get in trouble, but I just really got to have it and I want it, so I'm going to do it. And not remembering that last time when you did that, you lost your TV time for the rest of the night, and that's probably going to happen again, that there's no way to have the ice cream without getting caught. So not thinking through the whole situation before engaging in whatever the behavior is. And what we also see is that this makes it difficult to kind of learn from past experiences. So we call that kind of limited hindsight, or where it seems like they don't seem to learn from their experiences. And they might have limited foresight, or kind of they might appear to be less motivated by future consequences. And unfortunately, what we see sometimes is that parents or teachers can then really try to over compensate for that by giving too harsh of consequences or punishments in order to really make sure that the child learns from their mistake. And that tends to not work well, because it's not that they don't care or that they don't want to do the right thing at the right time. It's this really difficulty in controlling their behavior in the moment. Okay, so it looks like not doing the right thing at the right time. It also is poor planning ability, or having a hard time estimating how long certain tasks will take. We really see sort of poor planning skills, especially in middle and high school students, but even in an elementary school student, they might perceive particularly difficult tasks, or tasks that they expect to require a lot of effort, that they're going to take a really long time. And they have difficulty kind of doing the task or the small thing now in order to meet a future goal, which is a fancy way of saying procrastination. They can often feel caught off guard when it's time to transition from one task to another. And they can often miss deadlines or run late, or have deadlines sneak up on them. Okay, so let's move to the next point. Self-talk. Internalized speech is really this the conscious thoughts that we use to guide ourselves through doing a task. It's important for matching our behavior to the rules that we've kind of learned in life, and it's also important for kind of pausing and reflecting on our behavior after the fact. So when we have difficulties with internalized speech or self-talk, this looks like more frequent blurting out, less thinking through things in the moment, decreased kind of understanding of the things that you see or hear or read, having a harder time following rules and routines, and forgetting to use kind of social or group rules to regulate behavior. And so we just see that this is more inconsistent in kids with ADHD rather than decrease necessarily. There's also poor organization of self and being able to organize your materials and your belongings, as well as organizing your thoughts. Thinking through your main points before you make an argument about something or in a conversation informally too. Okay, emotion regulation. So people might not often or at first think about emotion regulation as something that's tied to ADHD, but it's probably one of the most frequent things we see in our clinic is, kids that have ADHD that really have difficulties regulating their emotions. Sometimes that might be frustration management. Sometimes that might be anxiety. It could be irritability. It could be getting upset in the moment. Sometimes it'll look like oppositional behaviors or kind of breaking the rules. But really, it often is this sort of root executive function of being able to control emotions. And emotion regulation is necessary for kind of pursuing goals. It's really important for motivation, but it's also what that executive function, just like the what is responsible for attention or behavior regulation. This is sort of attention for the emotional or control over the emotional reactions to things. So being able to kind of filter. Oh, yeah.
Hi, Melissa. We have a question in the chat.
Yeah. Yeah.
Based on all of the areas of impairment, working memory, decreased inhibition, how do we decrease our expectations? How do you manage the repetitive behaviors despite the repeated consequence? And how do you manage repeated infractions?
Yeah. Yeah. I think we're going to talk about that tonight. I think my goal in introducing some of these concepts is to help you have an appreciation or a different kind of lens through thinking about ADHD, because most often what I see is that folks come to us or with it when they first diagnose with thinking that that these are sort of intentional things that your child is trying to do. And one thing that we know is not helpful is when we have consequences that are, too severe, too long term to change the behavior. And so we're going to talk about behavioral strategies and other strategies to help kind of compensate or manage these behaviors. But there are key things that you can do to really shape the environment to make it more easy or more consistent for your child to kind of follow through or do some of these things. But it also requires a lot of patience, and there's no perfect way of doing this. There's, I think that's one of the hardest things is sort of learning this is where your child's coming from, and now trying to approach the situation with a little bit maybe more appreciation for that. So that's my goal in these first few slides, and then we're going to dive into some behavioral strategies here soon.
Thank you.
Yeah. Thanks for pulling that out. Okay. So when you don't have great emotion regulation, you see a lot of frequent tantrums, frustration outbursts. I put on here impulsive oppositional behaviors or reactive aggressive behaviors. Because one thing that I've seen a lot in our clinic and in the research is that oftentimes ODD or oppositional defiant disorder is overdiagnosed in ADHD because it is thought of as, sort of intentional acts that a child is trying to defy authority. And usually what I see anyways is that that's not the case. Often it's that they're having this really impulsive action in the moment. Maybe they acted on an emotion or something that was stimulating or engaging to them, and they broke a rule by doing that, but it wasn't intentionally trying to sort of defy adults or break rules. And so oftentimes that it really is this root of not being able to think before acting. All right. Emotion regulation can also impact some of the other things with working memory that we talked about and kind of having a hard time persisting on difficult tasks, and starting and finishing tasks is really, really difficult if it's something that they aren't inherently interested in or is not inherently engaging to them. So I like to say it's like starting and finishing tasks that the child enjoys is like riding a tricycle downhill. It feels really easy, maybe even fun. The wind's blowing in your hair, but starting and finishing tasks that feel uninteresting is like riding a tricycle uphill, and it's very hard. And unfortunately, what we see a lot is that for those tasks that they don't like or that's not inherently interesting to them or it's difficult, they rush through it. This reduces the quality of the work performance. Then sometimes an adult asks them to redo it. You have to redo your homework, or you have to retake this test because your score wasn't high enough. Now they dislike the task even more. They want to rush through it even more to get it over with, to get it out of the way. And this tends to lead to those tasks that might not at first be interesting. They either get procrastinated or put off. Or they can also be seen as being irresponsible or needing a lot of nagging or follow through. Okay, I'm gonna get through the last couple so we can get to the strategies part. Planning and problem solving. So this is the ability to use what you've learned in the past to apply that to new situations in the future and in the present moment. So it's taking kind of what things you've learned in your past experiences and putting them back in your mind together in a new way to solve a new problem that you're faced with. So this is a really sort of advanced executive functioning skill. We wouldn't expect this much in much younger kids. This is something that as kids get into preteen ages that they should be able to do with some support with adults. And as they get older and older, they should be able to do more independently. Oh, come on. So when you have difficulties with planning or problem solving, that can lead to challenges with applying in new situations that feel challenging, or having a hard time kind of coming up with more than one way to achieve a particular goal. All right, and the last part of this model that I want to talk about is self-control, which is sort of the putting it all together. What executive functions do are the self-control. It's your ability to kind of control yourself and less letting the moment control you. So self-control refers to changing one's behavior in the moment to achieve some goals. It's related to physical activity levels. It's important for being able to follow through on goals or tasks to get things done. And it's also responsible for kind of trying something new when you hit a roadblock and something isn't working. You need self-control to kind of stop and think, okay, I'm trying this, it's not working out, I need to try something else, and be able to let go of the previous thing, let it the past error go and try something different. Okay. All right. So one thing I like to point out about how ADHD fits into all of this is really that ADHD, it stands for attention deficit hyperactivity disorder, and I think the D in ADHD is not the deficit part, anyways, is not a great terminology. Because it is really about this developmental sort of inconsistency or difference that we see in kids with ADHD, but not that they're not capable of doing these things. So across each of these executive functions, we see a wide range of individual differences or some different strengths and weaknesses in different kids, even within ADHD. So I like to say, you've met one person with ADHD, you only met one person with ADHD. They're all so different. Everyone has different strengths or things that are challenging to them. And there's sort of no one size fits all, even though we can identify certain, clusters of symptoms. Even within that, these executive functions really look different in different people, and they continue to grow and develop with development of your brain and with practice and behavioral supports too. All right. Any questions about what we've covered so far? I know that was a lot of information that I packed in. Okay. All right. So this is one of my favorite quotes from Russell Barkley. It's ADHD is not a disorder of knowing what to do, but of doing what one knows. So that's, now that we're going to shift and talk about what do we do, how do we help manage ADHD, I'm going to keep this kind of quote in mind, because it's going to kind of come back in how we think about things. So it's not necessarily that we need to teach children with ADHD something that they don't already know, which is why kind of lecturing or repeatedly telling them something after the fact might be less effective. but it's helping them doing it what they know to be the right thing in the moment. So let's talk about what we can do to help and what we know about the effective management of ADHD and why it works. So I'm going to share some of the research that my group has done and some of our colleagues in ADHD have done over the years, and how this has formed kind of how we know today to effectively manage ADHD. So this research I'm going to be talking about today is really based on a lot of research that's been going on for probably the last 50 plus years now. We know about the impacts of ADHD, how it impacts day-to-day functioning, and some of the core components of some of these behavior management, academic and medication strategies that I'm going to share have really been around for quite a while. I intentionally called our presentation tonight a management of ADHD, because I think that term management is an important kind of mindset to have over the word treatment, because management implies that you need this ongoing process of monitoring and intervention, whereas treatment means there's a cure, there's a fix, maybe there's something preventative like a vaccine you can get to make the symptoms not be there, or you take ibuprofen when you're feeling you're experiencing pain, and it fixes it, it makes it go away. Management implies that we need to kind of keep doing it in order to manage the symptoms or how they impact our lives. So a lot of the strategies I'm going to talk about tonight, it's important to think about how these could be incorporated into your daily habits or life at home, and that's what we know is really important for ADHD, is that these approaches kind of are maintained in different areas. So I'm going to talk about each of those three areas. First, I'll talk about medication, and then I'm going to go into behavioral and the academic as well. And I want to give this caveat that I'm a psychologist by training, so I'm not a psychiatrist or a medical doctor, and so I want to share with you all about what we know from the research about medication for ADHD, but I'm not necessarily recommending ADHD. But I want all families that I work with to be informed about what the research says about medication for ADHD, because it is a part of an effective management of ADHD. Those three pieces, the most research has shown that kind of having a combined approach that includes medication and behavior strategies together, that helps the most kids. However, we'll talk about kind of individual differences and maybe different approaches to medication. But if folks have questions as we go through, I'm happy to answer any questions or any concerns that you might have. Okay, so what do we know about medications? They're helpful in reducing the behaviors in ADHD. So there's a lot of research that's shown that they reduce the symptoms. And while they can help with making those behaviors associated with ADHD be reduced, they're unlikely to fully kind of correct. What we often see is that behavior interventions are more helpful for the daily functioning and sort of how they do at home and school, but medications can be helpful for reducing the symptoms. Impact is temporary and short-lived, so it's kind of just like wearing glasses. It works when you have them on, but it doesn't work when you don't take them. So it's very short-term, and it doesn't have last, and it lasts only as long as it's in a person's bloodstream, which the stimulant medication, which I'm going to talk about, which are the most effective and the most studied medications, these last in someone's bloodstream or in their system for 24 hours, and then they're gone. So they don't build up in your system over time. And there are also other classes of medication that are non-stimulant options. I list some of the different names here so you can see the ones that have been studied the most. But of course, if you have questions or you're thinking about medication, you should talk with your child's pediatrician about those. All right, possible side effects from using medication. Some of the most common ones are decreased appetite and difficulties falling asleep. Other less common ones can be tics or cardiac concerns or other kind of more serious cardiac arrest. Although these happen in very, very few cases, it's important to know about these. And this is why when you're first diagnosed and you might start a medication, that they should monitor your heart functioning very closely. And as you continue, oftentimes what we see with the difficulties with sleep and appetite are that it can be when a dose is taken too late in the day, or sometimes I also heard families say they kind of made their child kind of not be their child anymore. They didn't kind of lost their personality or their funk or who they were, or maybe made them feel like more of a zombie-like state. And when medication has sort of that like sedating effect on your child, that means it's too high of a dose. So there are different doses of medication for each of these that I shared, and your doctor should always start at the lowest dose, and they'll kind of work their way up, figuring out kind of with your child's biology and what their body and how much how quickly they process that medication, what is kind of their therapeutic dose. And so sometimes they shouldn't need to get to, the highest level, but what that looks like is different for all different children. Okay, so I'm going to talk next about behavior management, but I just want to pause and see if there are any questions about medication. I can't see the chat, so if there aren't any, I'll just keep going.
I don't see any in the chat.
Okay, great. All right, so let's talk now about behavior management. So medication and behavior management at school and home are the core pieces to managing ADHD. And what that means is really shaping the environment in a way that helps improve the child's behavior. Kind of like medication, they only work when you use them. So one thing that we see that can happen is that you might try a certain strategy out for a little while. It works, it reduces the behavior, and so then we kind of stop doing the strategy. Like maybe you have a rewards chart, and it helps them following through with their routine, and then you kind of stop implementing the rewards chart because they were doing the routine. And maybe they keep doing the routine, but maybe they don't. And that's where that inconsistency and sort of unpredictability with ADHD can play in, and we don't know. But we do know that if we continue using behavior strategies, that can help support behavior. And so with behavior approaches, what we're trying to do is not teach the child to be more attentive or less impulsive or think things through or be less hyperactive, but we're trying to kind of remind and motivate them to engage in that more positive behaviors that you want them to be doing. So you think about the other things in the environment that are stimulating and engaging. We're trying to compete with those things to make them more interesting to do and more rewarding to do the right thing. And over time, doing that desirable behavior can lead to feeling more successful, having greater self-efficacy, and feeling better. And then that also leads to more intrinsic motivation to want to do that thing over time. But we have to at first really work hard to motivate that behavior. So there's three pieces, I call it the golden triad, that are important to keep in mind for managing ADHD. Number one, interventions only have an effect on behavior in the settings where they're used. So we shouldn't expect things to generalize to other settings where that intervention is not present. So for example, this is why we don't do talk therapy with a child with ADHD. We don't have them come into our clinic and hang out with me and talk with me for an hour and talk about skills. for regulating their attention or impulsivity, and then expect those skills to stick just from that conversation that we had, because that intervention was happening in that therapy room, but it wasn't happening in the moment where those skills need to be play out. So that means the strategy is really, we work a lot with adults, parents, and teachers to apply these behavior strategies in the moment at home, in school, during seat work time, during circle time, really thinking about those situations and the settings where the symptoms cause the most areas of difficulty. So they have to be provided in the moment. This also means doing an intervention or behavior approach at home isn't going to really have much impact on behavior at school, and the reverse. You kind of need both things in place to function well in both situations. So the second part of the golden triad is that these interventions are trying to externalize what is weak internally. So we talked about all those areas of executive functioning that are developing in children with ADHD a little bit slower, and maybe are a little bit more challenging for them, like weaknesses in working memory or self-talk, impacts their ability to kind of engage in certain behaviors that they want to do, or not procrastinate or get started on things. And so what we're trying to do is fill their environment with things that help compensate for those weaknesses. So that can be things like consequences for following through with rules, posting the home rules on the refrigerator, or posting the classroom rules in the classroom, being prompted before going into situations that are typically challenging, like before going to a birthday party, reminding them that remember they're going to be opening presents, and then you're not going to be getting a present, and whatever those like challenging situations are, prompting the desirable behavior right before it, as well as providing lots of prompts for the passage of time. So that means when television time or screen time is about to be up, that they're given a 20-minute reminder, a 10-minute reminder, a 5-minute reminder, and a 2 or 1 minute reminder. They need multiple prompts for that passage of time in order to be prepared once that minute is up and it's time to go. And then the third thing is that we want to maintain these interventions over the long haul. Management of ADHD really is a lifelong process. It's not a time limited, treatment that, can be done once and after it's over, the improvements, stick around. None of these things that we're going to talk about tonight cure ADHD. They simply help to manage the symptoms to make it easier to function in day to day. So gonna go
Melissa,
into.
we have a question in the chat.
Yeah.
The interventions at school are almost always punitive, and usually the shaping of the more appropriate behaviors doesn't occur. How do you suggest parents address those concerns with the school team?
Yeah, well, that's a tough question. I guess I kind of have more follow-up questions. I think I would kind of want to, as a parent, talk with the teacher about what's happening in the situation, sort of what are some antecedents, what's happening before the behavior, what's happening after the behavior, to understand kind of what are the ways that the classroom could either be structured different, that the way the teacher could prompt something in a different way, what are things that are modifiable that can be changed about the situation before the situation happens. So that's sort of like thinking about things from the front end. And then a lot of times too, when parents try out these positive behavior strategies, like giving descriptive praise for catching their child being good, or using instructions and giving instructions in a very specific way, that these strategies can result in really big growth in behavior at home, and sharing with your teacher about some of the things that you've learned and you've tried with your child and how that's helped. That can help have a collaborative discussion too about how they might implement that same sort of strategy in the classroom, what's a way that they could do that too. I think it's always best to start with talking with the teacher, and you're the expert of your child. Your teacher's the expert of whatever grade level that is that they teach. They see that grade level all the time, but they're not the expert in your child. So you really have to work together and think about in those positive or other alternatives that are less punitive. Think about ways to recommend that. We have a specific intervention called a daily report card intervention. I don't have time to get into that tonight, but I encourage you to Google daily report card intervention or DRC, and you can find different examples of it online, or I'll also have my contact information on the last slide, and you're welcome to email me, and I'm happy to share a handout on that with you. The daily report card intervention is sort of our evidence-based, most research-supported intervention for school-aged youth that is a sort of positive approach for managing ADHD behaviors. It can be used for inattentive behaviors, it can be used for hyperactive or impulsive behaviors, but it helps basically to break down setting really concrete, specific goals for your child throughout the day, that then they get checked on whether they, they'll get a yes or no, whether they did those behaviors, but it repeats throughout the day. So each, even if they're not meeting, 2 out of the 3 things in the first period of the day, there's all these other opportunities, and it's raised to them, as an opportunity to change their behavior around, so it doesn't feel as punitive. And it has more, it's more prompting of the appropriate goal behaviors rather than catching the thing after the problematic behavior has been there, which is what we're trying to avoid. Okay, I think each of these next slides, I think I talked so much on the first slide that I said most of these things. So I'm just going to go through and make sure there's nothing that I didn't say about how about these key points, but I think I said all of these things. This is talking about that we want to intervene at the point of performance, and here you go. There's a daily report card is given in as an example. At home, a daily report card can look like having a contingency management system or a structured sort of reward system of you have to get started on homework by this time, you have to finish at least 10 problems by this time, or check over your work with at least 75% accuracy before you have mom or dad or grandma look it over before you're done next. So sort of setting up structure around the behavior goals that you want to see. All right, well, I think we said all of these things too. We're not teaching new skills, we're helping them to learn skills that they already know. And these next few slides are just some of your key takeaways about what we know about ADHD and how effective multimodal different types of management of ADHD are important. Okay, and with that, I'm going to go into talking about the ABCs of behavior, and let me just do that. And we're gonna kind of break this down. I think this will help in answering some more of your question about how to make approaches less punitive in school. I think thinking out things through an ABC lens can also help when you're having conversations about what is the behavior that's happening in the classroom and what does that look like. Then we're going to talk about sort of using attention strategically. Attention is probably one of the most powerful tools a parent has in their toolkit. Sometimes we don't use it in the right way, the way we should, but or the way that we could. But we can really effectively manage behavior both by giving positive attention and withholding our attention. So we're going to talk about that. And that will probably take us through the hour. There might be some things that I don't have time to get to, or that I go fast through the next few minutes, but I do want to make sure that we get everyone's questions answered, and I wanted you to have access to these materials as well. So whatever we go too fast through, or that we don't have enough time to cover in depth, you will hopefully get these materials and you can review later too. Okay, So ABCs of behavior. What we want to do when we think about changing behavior is it starts with understanding what is the behavior. This might sound really simple, and you might be thinking, well, so why are we talking about what is behavior? I know exactly what my child is doing, because it's very bothersome and it's really impacting us. But oftentimes what we see, that what we call a behavior, or what we think is a behavior, often is sort of an interpretation of a behavior. And it's we have to really think about what is the observable, measurable behavior that is happening, because that's going to be the modifiable, the thing that we can change, because we can't climb into our child's head and make them do something. So we have to think about what is the behavior, and then controlling the things around that behavior is what we can change. So some examples of what behavior is: it's talking, it's reading, eating, walking, shouting, screaming, drawling. Sometimes behaviors are things you're supposed to do, sometimes things you're not supposed to do. So what's not a behavior? Something that is not a behavior is when we describe some sort of quality or characteristic of a person, like their personality, or to a judgment about something that they did, like saying Donnie is stubborn or mean or disrespectful. These are really common ones that I hear. Or unmotivated, happy, easygoing. These are not behaviors. These are sort of our interpretations of how someone is. And so when we apply these words instead of actual behaviors, we have a hard time changing them, because everyone's sort of definition of what that means or what that looks like could be really different. So I would say a dead person rule, which just means if a dead person can do it, then it's not a behavior. Because another thing that we often try to do is try to reinforce something not happening, and you can't reinforce the absence of a behavior. So if they're not doing something, we have to think about what it is that they are doing in order to change that. So being quiet, sitting still, don't move or don't touch anything. Maybe the behavior of that is using your hands appropriately, or keeping your hands at your side. Okay. All right. So then we have some. I'm going to just give you some answers, I think, because I spoiled many of them. Being lazy and being stubborn. These are interpretations about what your child is doing. They might actually be tired or distracted, or a lot of things that could be in different interpretations for how their child is acting. Okay, so let's walk through a couple examples of understanding the ABC model. So I just talked about what is a behavior. That's going to be at the center of the model, this blue part. It's what your child is doing. And we also focus on antecedents. So these are things that happen before your child acts. So this could be things in the moment. If we're talking about the school day, it could be the classroom itself, other students around your students. It could be something the teacher said. It could be the time of day. It could be situations or things that are happening around that behavior, as well as sort of the environment. Consequences are anything that happens after the behavior. So that could be a positive thing or a negative thing. So antecedents before, consequences after. So let's walk through one example. You tell a joke, you're at a party, that's the antecedent. You tell this joke and everyone laughs. And so now that laughter, that was the consequence, that's going to make it more likely that you tell this joke at a party again in the future. You're probably going to tell that same joke at the party in the future, especially if you're my father. So any behavior that's reinforced is going to be more likely to occur again. Now let's change this up. You're at a party, you tell a joke, and no one laughs. So now you try something else, because that lack of laughter, that's going to reduce your chances now of telling jokes at this party or telling that joke again, depending on how punishing or impactful you find that lack of laughter to be. So basically, any behavior that's not reinforced is going to be somewhat less likely to persist again. Let's change up the antecedent now. Now the antecedent is you're at a funeral. You tell a joke and you get weird looks. That's the consequence. People will look at you funny, and now that consequence is going to reduce your chance of that happening again. And so a behavior that's punished is going to make it less likely, especially less likely to occur. So let's apply an example to children. A child has a meltdown in the classroom. What is the behavior and what's the antecedent and the consequence? Well, in this situation, let's say your child gets sent to the principal's office. The meltdown in behavior is in quotes because meltdown's really not a clearly defined behavior. Your teacher might use the word meltdown, and that might mean one thing to them, but meltdown might mean something totally different to you. And so you want to make sure that when communicating about your behaviors with others and with your child, that you really try to specifically define that really clearly, so we understand. We can't really change it if we don't know. We can't change antecedents and consequences if we don't know what the behavior actually is. And in this situation, perhaps we don't know the antecedents either, and so we're unsure about how effective the consequences can be. But let's throw in, say that we learned that the classroom is loud, it's distracting. This is really starting to overwhelm your child, and they have a meltdown, which is them trying to escape this uncomfortable feeling. And so the meltdown is kind of being negatively reinforced because them getting to leave the situation, the consequence means that now they're going to be more likely to have a meltdown when they're in a loud, distracting, overstimulating situation, because they kind of learned in this situation that when something's unpleasant, if I have this meltdown, then I get to leave and escape that situation. So it sort of has this unintended consequence. So the teacher thinks going to the principal's office is going to change that behavior, but really it just makes that behavior happen more often. So sometimes learning to problem solve specific behaviors, a lot of it comes down to this ABC model and understanding exactly what is happening, the antecedents and the consequences. And this means talking with other caregivers about this, and as well as teachers and other folks who work with your child. So in the future, one thing you might try over the next week is try to just draw out A, B, and C and start in the center. Think about behavior and what it is that you're struggling with your child. Focus on really defining it in behavior terms, which means like something you can see, you can clearly observe it. And then think about what's going on around it, what's happening in the situation or right now, and what's happening right after it, and how are those things either making that behavior happen more or less often. So there are different things you can do. Then you can change antecedents and you can change consequences. We really can't, like I said earlier, we can't climb inside our child's head and or make them move like a puppet or make them do different things or change their mind about things. You can't change the behavior for them, unfortunately. What we can control are antecedents and consequences. And that's how we have the greatest impact on behavior. So we can either change what happens after the behavior, or we can change what happens before. And these can be both positive and negative sort of things that are experienced by the child on both sides of that. So we'll talk a little bit about some consequences. Okay, all right. I think the next slide, I'm going to go into ways to use attention. I mentioned sort of consequences, but it can be used actually both ways as an antecedent and a consequence.